there.
So, Nikki, that was a great talk. I have a couple of comments. One has to do with your comment about New York when they amazingly published these crude outcome data for cardiovascular disease, and people couldn't believe it. But in the end, the measures were improved and people talked, and my understanding is that the bad actors were weeded out of the system and quality of care improved with an imperfect measure. So we're doing the county health rankings. It's an imperfect measure of the health of a community, and I've heard someone came up to me a couple days ago and sort of reluctantly admitted that he didn't like it at all and was going to criticize it but didn't want to offend me. So I would ask, just as the New York measures were crude, when we are doing these rankings, they're crude. They could be improved, but we won't make them better unless we hear from people who have criticism and thoughts about ways to improve them. In a way, the arguments are an outcome we're interested in. How often do people argue about ways to measure the health of a community? So I think there's a parallel to what happened in New York. But my other comment has to do with your mentioning tenure. And I'm now responsible for changing a medical school into a school of medicine and public health. And the tenure system is horrible. It forces people down these long, dark tunnels to become specialists, and I don't see them come back. But we've done one little change in that we have a new tenure. People worked long and hard in Wisconsin to have a new type of tenure, which is called an integrated package. In that, in the past, you had to be outstanding in one sliver and then do some other stuff. But now you can be integrated across not just research and teaching, but service, broadly defined. So we'll see. I just reviewed a packet that would have been an outstanding proposal to be an integrated package for tenure. And the idea being that clinicians and community practitioners really, by being so diverse in both practice and research and teaching, they are unlikely to get tenure. I just reviewed a packet and it looked like an integrated packet, but culture told her to go for outstanding in research, which may even be a challenge. So changing that culture, I agree with you, it is really hard. It may take generations to change the tenure culture. I don't know if you've seen successes around the country and have stories to tell, but I think that would be a nice thing to share if people have actually seen successes in changing the culture of tenure and seen better outcomes.
Good, thanks. Great comments. In fact, when you stood up, I was thinking immediately about the set of issues about quality measures and they're not being perfect, and the work that you and Dave and others have done, I think is really path-breaking in so many ways. It also builds upon a less perfect set of measures than the ones that you guys have. And the next generation will be a better set of measures than the ones that you guys did. But that will only happen if there are consequences to those measures in some sense. If communities need to do something with them, if they get more or less money, if people move in and out of communities, if there are choices that result from those. And so one of the things I think will be really important to understand at the end of the day is how those things get used and what are the policy levers and policy drivers that get them used, create change, and where the resistance is so that you can think about making them better. And so I hope that now that we're sort of past the big sort of media blitz of them, that we'll really think about, at least in some parts of the country, how are those things used? And for the people who choose to ignore them, why are they ignoring them? Is it because they just don't care? Is it because of something about the measures? But how do they, at the end of the day, drive change? And I think that will be really, really important. But very much applaud. And I've watched this work develop for a long time, and I'm very excited to see, where it's at. in there. Regarding tenure, I think it's a really difficult issue, and I have, probably a really glib answer, which is, at the rate at which we are cutting back at investments in public education, we might not have to worry about it because tenure might just be gone. And that might not be a bad thing. It will be different than the world as we know it, but it might not be a bad thing. Don't know. I can, share my own experience. My training in medicine was in primary care, and the field of academic general internal medicine was certainly just developing when I was finishing my residency, and I got very involved in my own professional society, which was the Society for General Internal Medicine, and at some point, we realized that, nobody in academic general medicine was getting promoted because some of them were clinician educators who did service and who made changes in their community, and because nobody understood the methods and the data that academic generalists were using to do their research. And so really step back and develop sort of a whole kind of education process for medical school professors and deans about what was the field about, co-opted a group of deans to come together and work with us to put together standards for promotion and tenure that recognized a new field. And one of the things I took from that is that for a new field to be successful, that's probably something you have to think about at the front end rather than the back end when people aren't getting promoted. And so might encourage some more thinking in that area if you're going to take the gamble that tenure is going to be around for a while. The other is to help people understand that most people who really make a difference, particularly, through their research, are usually pretty passionate about what they do, and they write a lot anyway because they're passionate about what they do, and they want to share it with the world, and they view that writing and publishing is one way to help it spread. So if they do it for that reason rather than to, rack up the number of papers on their CV, they'll probably be just as or more successful than if they went down some little narrow rabbit hole where at the end of the day, they didn't have the passion for their work and really couldn't put pen to paper and get it done. So that's certainly been my own personal experience.